So my name is Mary Paige Smith, and I'm a nurse practitioner and a certified neurotherapist. I first became involved in neurofeedback in 2010, and I started into it to help my son, who was really struggling with some behavioral problems in school as well as sleep issues. Actually never slept past 5 a.m. And so that was creating a lot of issues at school as far as having problems with attention. He was just tired all of the time. I went to the pediatrician, and she had suggested different medication options. And the next day, whether or not there are coincidences, I heard Dr. Hoffman speak about using reference EEGs to do medication matching. And the more I checked into it, the more I thought, well, I should just try neurofeedback. So that's how I got started. And within the first 6 weeks or so of using neurofeedback, the results were amazing. My child, who had never slept, started sleeping 10 to 12 hours per night, and that really helped to change his behavior and make him a lot better to be around. So that's probably one of the main reasons I got started into it. But then other people started asking what I had done with my son, what medications was he taking, those type questions. And when they learned that I was doing neurofeedback, they started asking me to then train their children. So I initially was working with just day med equipment, and in 2012 I went to the International Society for Neurofeedback Research Conference, and that was actually the first time I heard Dr. Coben speak. And his topics that I attended were on autistic spectrum disorders and dyslexia. And my daughter actually was diagnosed with dyslexia and had made it to 3rd grade without being able to read. So after that conference, I contacted Dr. Coben and asked if I could start training with him, and switched over to using the Eager software. And initially we were using 2-channel training, and then we switched to the 4-channel multivariate coherence training, and that was unbelievable, especially for my daughter. And primarily now in our practice, we see a lot of children with behavioral issues, learning disabilities, anxiety, depression. The adults that I see in my practice come more for anxiety, mood issues, and sleep problems. We do also have a fair number of kids who come because they've had head injuries. So it's been really beneficial across all of those areas. And we live in a mountain community, so I have a small practice up in Evergreen, Colorado, and then also have a location in Lakewood, Colorado, which is just outside of Denver. So pretty much serve all ages. Our youngest client was 3, and our oldest was in his 80s. When I first started working with him was following that conference, and it has been really beneficial to work with him, especially with our seizure patients. It's been excellent to have him as a resource to be able to review the seizure maps and give recommendations for protocols, as well as be able to have access to his research to share with patients, especially along the lines of the autistic work that he's done and the learning disability work. This past summer, we did a combination of neurofeedback and tutoring with a local reading specialist, and we're able to get great results for our clients. And with my daughter, I think that after I started working with Dr. Coben and we started doing the multivariate coherence training, one of the biggest differences for her was the ability to recognize when a word was spelled wrong. I think a lot of kids with dyslexia just can't even recognize that the word is wrong, so they don't correct it. So that was one of the first things that we noticed with her, was the ability to recognize that it was wrong and then since all of our kids live in the spell check world, she could right click and then choose the appropriate word to use in her papers or the appropriate spelling for the word that she was looking for. And then with her, she actually was able to advance to all high-level classes through high school. She got a 35 on the reading portion of the ACT, and is currently a double major in biology and exercise science at High Point University on her way to pre-med. And I honestly believe that would never have happened without Dr. Coben's guidance for her dyslexia. A lot of our children have come to us with diagnoses of ADHD, and then with testing and then with the brain mapping and using their NeuroWrap, we've been able to look more closely at what is actually going on with their brains. And several of them, I would say probably close to 10, have actually then been diagnosed either as doubly gifted or as just having a learning disability and actually not having ADHD. And then another big piece with the children with behavioral issues is able to actually diagnose them with a social anxiety disorder or just understand why they don't function well in social situations. And I would say, you know, again, back to my son who was having a lot of issues in third grade when we got started with him, he has subsequently been able to skip 7th grade. He started the chess club at his high school. He, much to my dismay, plays football, so hopefully won't be using neurofeedback for a head injury, but has just really excelled. And I think that with him working on that right side of his brain and helping with the social understanding was hugely beneficial to him. And we've certainly seen that in other clients as well. The other thing that I would say is because I am a nurse practitioner, I'm able to add in some other more medical-based treatments. So for the rare client that isn't achieving everything that we are hopeful for from neurofeedback, that's actually just given me another avenue to look into food sensitivities and nutritional deficits and help to support the client in that manner as well.